Good evening, everyone. My name is Denise, and I'm with White Cedar Wellness, and I am here with Andrea Kruger from IRP Health, and we're going to have a little bit of a conversation talking about IRP Health and what they can do for you, what they can do for people who might also be a friend of yours who needs a little bit of help. So, Andrea, thank you very much for joining me here on this little webinar here. My whole purpose is to welcome you to 368 11th Street in Courtney, and this is going to be really exciting. I am so impressed and so thankful that there are services like yours out here, and that you're now in the Valley. The Valley where so many veterans have retired, and they are very much in need, I think, of your services. And these services, to me, really go along with a lot of the heartfelt things that I have and the people that we have been serving over the years as well. So without much ado, I'm going to ask you the question here. You know, what is the background on IPR? Like, where did it come from, and what's the name all about?
Yeah, thank you for the welcome. We are also excited to be in the Valley. Hi, Mark. So IRP Health is Integrated Rehab and Performance Health. We started down in Victoria, where we have a clinic that operates with a small multidisciplinary team. And so we're really excited to be collaborating with you, Denise, and the White Cedar Wellness Clinic space to, get services up and running and get these programs basically just available into the communities now that we've found this amazing studio space. So we've got 3 programs that we can offer. One of them, we're waiting on a little bit of information for confirmation. So right now we're focusing on 2 of the programs. One of them is 6 weeks long, one of them is 12 weeks long, but we can jump into more details about them later. But yeah, it's basically a veteran and RCMP centric environment. It's meant to be in small groups, and it's got really great reports from the people that we've worked with over the past 3 years down in Victoria. And
there's more than just one, like there's more than just the IRP Health in Victoria though, right? Like this is across the country as well, right? So you're really taking the experience and expertise of folks who are really, as you said, veteran-centric, and being able to apply that across to everybody that's here as well. Is that correct?
Yeah, so we have another clinic opening in Ottawa right now, and soon in the future, one in Halifax as well. So we'll be hopefully on both coasts before too long. We've got a team that we're putting together in Ottawa, so we aren't working with anybody in the public yet. So we're just building a really great team there right now and building out the space. And here in Comox, we've had the pleasure of working with a small group through RCMP, and now with going through the clinic here, we're opening up to other like veteran programs. So, and we also offer, as you can see on the background, physiotherapy. So we've got one-on-one physiotherapy. We've got this transition program, which is the actually 6 weeks, sorry, it's not 12 weeks, it's 6 weeks. And then the reintegration is 12 weeks as well. And each of them are a little bit different, but basically we just noticed from all the feedback of the people that we were working with in Victoria, the veterans that we were working with, where, they were talking about how I have to go to all these appointments all over town. I go to physio here, I go to chiro there, I go to massage, and I just spend my entire day kind of like running around different appointments, having to deal with traffic. So these programs are designed to kind of work with everybody in-house, so you don't have to spend your entire day going from one appointment to the other. The reintegration program, for instance, is a physiotherapist and an athletic therapist, which happens to be me in this case, working together 3 days a week. They're 90-minute sessions. You show up at the same place at the same time. You don't have to book any appointments or things like that. So everything is, because it's a program, it's just a little bit easier to access the services if you're approved.
Okay, so can you just explain a little bit more about what that means, reintegration program?
Yeah, so the idea is that the one other program that we're hoping to be able to offer in the future is a 5-day-a-week program. So you can see that there's a 2-day-a-week program, a 3-day-a-week program, and a 5-day-a-week program. So not everybody, all of these programs are based on approval through a case manager with Veteran Affairs or Occupational Health Services internally. And so if you're approved, the idea being that, oh, well, based on, your comfort and what's realistic for you in terms of, what seems like a good fit with where you're at in your life as it relates to lifestyle or goals, maybe 2 days a week is best. And then taking on something a little bit more active 3 days a week, and then maybe eventually taking on something even more active 5 days a week. So we just wanted to be able to have a starting point for everybody, because we want to be able to meet people where they're at rather than just only having one program that's 5 days a week, because 5 days a week for an hour and a half is about 90 contact hours. So it's a bit of time. There's a lot of impact and progress that we make, but it's also a big commitment. So yeah, just having different entry points to be able to just meet people where they're at. And, some of them don't really focus on exercise as much, such as the transition program, where it's more of like an occupational therapy, physiotherapy kind of thing. And then the reintegration has a little bit more focus on exercise. And then the 5-day-a-week program, which we're hoping to be able to offer in the near future, is even more of an emphasis on function, because, getting people active and feeling like they can participate in their lives is really, what this is all about in any sort of way possible.
So you mentioned down there highly individualized coaching for each person within the group. Are we talking the physical coaching? Is there any sort of lifestyle coaching as well that's in there?
Yeah, so being that these programs are like geared towards people who I guess could benefit from the support of a physiotherapist and an athletic therapist as it relates to feeling afraid of injury because you've experienced an injury and have chronic pain. All of these programs basically are meant to help create or minimize barriers of entry for people to get moving in ways that they maybe haven't, and to also understand the feedback of their bodies, because some people are like, oh, well, it hurts a lot when I do that, but they're, let's say getting up and down off of the ground, for instance, I have trouble getting up and down off of the ground, and I'm afraid of falling and things like that. So figuring out individualized ways, because each person is unique with, whether it's one injury or multiple injuries, also really paying attention to how longstanding injuries can affect mental health is paramount to how we, I guess, deliver the coaching, because even though we work with a veteran population and RCMP population, I am civilian. That is on purpose. We are not, taking an approach to exercise that is do as I say or else. It's very collaborative in nature, and wanting to make people feel comfortable in whatever way possible, so that they can figure out strategies for them specifically to feel like they can get more out of their day, whether that means, being able to change a tire or cut the lawn or cook for, do meal prep or whatever for longer periods of time between feeling like they need to take a break because the injury kind of like creates a bit of a limitation.
Those are really good points, because I see it all the time. People they have an injury or some sort of chronic pain situation going on, and then they become very, their life and their lifestyle becomes very embedded in that particular injury, and then they start to live very restricted based on whatever that physical injury happens to be, and so they the quality of their life, if you will, is really at stake here, and they're just not able to, like you said, function, but even enjoy life. They've, for the population I think you serve, they are, they have done an awful lot of work, and they have provided a lot for us here, and their bodies have really taken a toll. And if they can't enjoy life now, that kind of really sucks, because they really worked really hard for us. So that's,
one of the big things, one of the big things that we've received as feedback is, like, anybody who, whether, going through depot with RCMP or doing basic training with the military, one of the things that's common as a point of feedback is feeling like, I don't know specifically the kinds of exercises that I need to do just for me so that I can get, feel like I can do more without feeling afraid of hurting myself. So the education component, we have 90 minutes throughout a 12-week program in this reintegration program, which is a lot of time. So we have the luxury to be able to, it's different than just a physiotherapy appointment potentially where you get 20 minutes and then you get sent home kind of thing. We have 90 minutes in session to be able to, so this feels dangerous, or this feels confusing. Okay, well, what about this? What about this? What about this? Like, is this realistic? And we get to practice together over that 12 weeks. And then also over those 12 weeks, build out strategies for you to kind of like integrate. Okay, well, what about this sort of stuff can I do on my own? Because the programs are great, and we want you to also feel great after the program, which is a big part of it. So we're trying to have it be a collaborative process so that people feel like they have actually tools relating to, whether it's, now I work out, or now I just know how to move in ways that doesn't cause pain. Like, both of those are huge wins for most people. So the education is a key component of all of it.
And can I just say something?
Yeah, of course.
The bizarre thing is, many years ago when I got hurt in the military, I was maybe saw a doctor twice, 3 times. After that, it was just prescription drugs, painkillers.
Yeah.
And it wasn't until I felt I was being addicted to the painkillers that I physically manhandled one of the Med A's in the hospital. No intention to hurt him, but as I was doing so, a doctor, a major, came out of his office, and Sergeant Steele's like this, and can I help you, Sergeant? Major says, and he says, no, we got it under control here, but I think this gentleman wants to talk to you. So the major took me into his office, and this was after about 3 years, maybe 4, I'm not sure. Nothing but painkillers. And that day he sent me to a physiotherapist. And I was one of the very first people in the Canadian Forces to actually go to physiotherapy, because they didn't agree with it at that time. It wasn't part of their thing, right? You suck it up, princess. You go to PT 3 times a week with the rest of the troops, and that was it. I'd done chiro, and that didn't work for me, and that was probably in the first year. But after that, it was nothing but painkillers, OxyContin, and that sort of thing. And then once I started going to physio, I was able to wean myself off all of the painkillers and use physio. And then subsequent education, I did massage therapy and found a better chiropractor. And now with Denise, I'm doing physio again. I've been going for massage therapy regularly. That's the beautiful part about having a pension, that you pay for your medical. A lot of guys opt out of that. And so I'm covered, like completely covered for almost everything I want, and including this. So I just thought I'd throw that in there. If we'd had this sort of source for education, I might not have gone through 3 years, actually ultimately 10 or 12 years of chronic pain before I finally had a quality of life where I could actually, ride a motorcycle, walk at all, and and work without being on drugs.
Yeah, that's.
I really appreciate it. Thank you very much, Mark. Those are great reasons and great things for people to actually hear so that they can understand the value of some of these programs. So the individual physiotherapy is offered now. And so can I flip over to the next slide, Andrew?
Sure, yeah.
Because I think how to access these programs is pretty important. So from my perspective, ultimately it comes down to talking to you. So how do we get, you, or how do we get other people to actually do this is where I'm going to go. But I would really like for people to be able to reach out to you. And so how do they access these programs and services?
So yeah, great question. Denise, can you do me a favor and edit the transition program so it says 6 weeks instead of 12? Just so it's not confusing there. Yeah, if it's editable. So being that we are a VAC approved service provider, these programs are something that you can express interest in participating in directly to your case manager. And you can also have a doctor, your GP, fill out a referral form. If you have any other healthcare providers, such as a psychologist or a psychiatrist that you work with also, and they think that exercise would be beneficial in some way, they can also fill out a referral form. Typically, the GP referral form is the minimum requirement, in addition to sending an expression of interest to the case manager or through the MyVac account. As you can see for the reintegration and the transition program, if you have a case manager, the opportunity to get the conversation going around, how to get an initial assessment basically with the physiotherapist for these programs started is easier if you have a case manager, because that relationship is already established. And so if you don't have a case manager, then basically you're just going to submit through the MyVac account your expression of interest, and then again include the GP referral form, and Denise has a copy of that so she can send that out. And because the case managers are required to approve the requests or approve the expressions of interest, the likelihood, as you can see on the bottom line there, it says that funding is a little bit less likely in cases where you don't have a case manager who helps you figure out that stuff directly, but it is still worth expressing interest. So all of this is for people who have been medically released from service, and if you're a veteran, and if you're an RCMP member, typically working through occupational health services is going to be the route to get this conversation going. And again, for physiotherapy on the other side of the screen there, if you have a K number and you can provide me with that information, basically I'm just going to give Medavie Blue Cross a phone call and check to see if there's funding available, and if they approve it, then I would just help you set up like an initial physiotherapy assessment with the physiotherapist that we have on staff, Juliet and Brittany. So it's a somewhat, straightforward process in terms of expressing the interest and getting the referral. There's definitely a little bit of back and forth in terms of conversations once the program has been approved, if it's approved by the case manager, because then we can set up, once it's approved by a case manager, we would set up an initial assessment with a physiotherapist for the reintegration program as well as the transition program. And the transition program, you're working with an occupational therapist once a week as well. So there would be an initial assessment for that.
So quick question for you is, if say a veteran hears about this, they connect with me, they ask for that form, we get it out to their physician, and then it comes back to you, correct? It comes back into the clinic, and then do you help at all with the, making this move through, it's not greasing the wheels, but do you help facilitate a possible approval when you're bringing this to VAC?
Yeah, that's a good question. So ideally, the GP can fax the case manager directly. So that just eliminates, I guess, one extra phone call, because the case manager would receive the GP referral for the program directly. So that's the most efficient way to secure an expression of interest and show the case manager basically that you've done a bit of due diligence on your end as a potential participant or someone who's interested in participating. So definitely doing that is the number one place to start. And in terms of following the application from an admin assistance point of view, we are required to kind of be hands-off with that process. Once the case manager has it, then it's we just wait for the case manager to do their job and reply to the expression of interest. As a service provider, we're not going to be phoning the case manager, but anybody who can help or assist the participant in I guess, learning what the status of that application is, they're more than welcome to do that on their own. So.
Okay.
That's one of the things about us veterans is we like to have our hands held when we're trying to do stuff that we don't really want to do. First off, most of us don't want to get out. Most of us don't want to go to physiotherapy because we're strong. And we have to admit that we're broken in order to access some of these services, right? So it's the more easier it is for us, the more information that you, Denise, provide us to make it simpler. Like, for example, the other day, trying to switch my provider, it took me 45 minutes on the phone call talking to 3 different people. I was ready to hang up after the first 5 minutes. I just don't have the energy or the time to pull that stuff. And same with moving on to a different process. Denise made it easy. I didn't have to apply for anything. I just walked in couple Mondays ago and saw my physiotherapist, sat with her for 40 minutes, whatever. And it was easy. I didn't have to make the call. I didn't have to book anything. It's just, hey, when do you want to come in? That was it. So I didn't have to reach out for that, right? Or go looking for it.
And I think that's exactly what we're excited about with this partnership, where it's, Denise already has so many pre-existing relationships with you guys in the community, and adding on these services is just within the same building and location that you already are familiar with and know about and have probably been to, is just something, I guess, that we see as a value add to the value that Denise is already providing. So it seemed kind of like a beneficial way to add on some value.
Yeah.
Thank you. Thank you. I appreciate that, and I really would like to see success for veterans, and I would really like to see success for IRP Health. So that's my goal. That's my from there. Okay, so any more questions? Is there anything else you'd like to say, Andrea?
Well, this type of, I guess, service doesn't really, there's no other clinic in BC that's dedicated just to working with veterans from a program perspective, where it's in small groups and stuff like that. So we've created this offering, I guess, this type of service simply based on the fact that, working with veterans in Victoria, where all of this started, the feedback was, I don't want to have to drive around town to go to nobody. It's great if there's parking, which there is. I don't want to have to deal with crazy city traffic, all of that stuff is a pretty common trigger for a lot of people. And, you know, having accessibility to services where it's all in-house and you just show up at the same time for 12 weeks, it's a really nice container. We actually get to build a relationship. I come from a military family myself. My dad and my brother are both, well, my dad's retired, but so there's definitely a bit of understanding that I have around the lifestyle that we afford to get the job done. Not from a lived experience, but definitely from a vicarious witnessing. So I just really am excited to be involved in something like this, that, you know, it's very clear that these types of services are needed for a lot of people. And the fact that, you know, creating a program simply for veterans where, you know, you can be in a small group and talk about shared experiences, use all the acronyms you want, and people will understand them. There's the fact that this isn't something that already exists kind of you know, is a bit jaw-dropping to me. So it's something that we want to share the information about, and all of the practitioners that we work with are very excited to, you know, be a part of something like this, because the veteran community is definitely a community that needs more support and representation in the healthcare system. So we're always looking for opportunities to make things better in any way possible. So, you know, if you have any questions or comments or feedback about any of this, definitely call me or email me, any of that. We are a small team and we can move quickly and change things. So it's been really good. I've been with the company almost 4 years now. So.
Excellent. Well,
I
thank
think
you very
teaming
much.
up with White Cedar is an excellent move, because when Denise and I first met just over a year ago, it was sort of a referral type thing. She contacted me and wanted to reach out to the veterans community, and I'm like, yeah, okay, sure, I'm going to check you out. And so I did. I actually sat down with her about an hour, I think, in her clinic there. And by the end of it, I had one question: how do I sign up? You know, and I've been in love with Denise ever since. I mean, I've promoted her to our group excessively. She's actually sat in my patio here and talked to a bunch of them. Several of them are now, you know, contacting her and part of her. And it was her love, her vision, and her compassion for the veteran community that convinced me. Not that she's a great person and she's got a great service, but her compassion and you know, like I said, love for the veteran community, and that's why I'm behind her.
Yeah.
And you do well with this mentality, so.
Yeah, that's palpable.
So I, just as a footnote to this, thank you very much for Andrea for doing this. And like I said, we're going to put this up on on social media. I'm going to give access to as many people as we can. The referral letter is going out to all of the physicians in the Valley that we have access to. So it will be on their referral. So veterans can go into their physician and ask for the referral for these programs. They can connect with either myself or with Andrea. Andrea's information is right there. And so I just want to get this information out there and get some more people some help. So
yeah, we can check out our website as well, irphealth.ca. All of the descriptions of the programs are available on there as well. And that's my personal / business number. So you can text me or call me at that number. And yeah, it's a confidential number. So anything we can do to help get the service out there to the people who would benefit most from it is definitely the priority.
Okay, thank you very, very much. And I look forward to seeing you guys soon. All right, take care.
Thank you.
Thank you.
Thanks, Mark.
Yeah, anytime.